Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forensic Medicine, and today we'll continue with regional injuries. In that, we'll discuss about injuries related to bones and joints. Bone injury can be contusion of a bone of its peritoneum, which may occur because of a blow or a fall. Because of contusions, underlying skin contusions, there may be underlying fractures which may occur from falls, blows, or action of the muscles. Indirect force involving the limbs. Fracture occurs at the site of impact. So if the force is more, fracture may occur directly below the direct impact. Some injury may present in the overlying soft tissue is also present, like contusions may be present. These crack injuries may be compound or communicated. Compound in the sense the bone and skin will be intact. Communicated where multiple fractures, multiple bone fragment may be present. If the violence is indirect, a simple fracture may occur in the region distinct from the site of impact of the force. Like if the person is a fall and when he tried to touch the ground, the force with the when he touches the ground may be transferred and there may be fracture in the femur. In simple or closed fracture, there is no communication between the bone and the air. So in simple closed fracture, the skin is intact. Like a fall on the outstretched hand will cause Colles fracture. That is the fracture of the distal end of radius. A compound fracture is where indirect violence may occur when fragment of a bone pierces the skin from the inside. So whenever there is underlying bone is present, if the underlying bone gets fractured, it may pierce the skin, outer skin, and may cause the uh, compound fracture where the skin and bone is both involved. So fracture part of the bone pierces the skin. In compound open fracture, there is communication between the bone and the air through the wound. Most spontaneous fractures may occur because of diseases like osteoporosis, osteomalacia, Paget disease, in which the bones are so weak that there may be spontaneous fractures, that is, fracture may occur without any injury also. In young children specifically, there is a fracture called as green stick fracture, which occurs as an incomplete fracture involving only part of the distance across the bone shaft. So has the green stick, when you try to break only uh, one part of the branch breaks, similar to that green stick fracture. If in young children's only the part, so one part is get fractured and another part is remains intact. Now coming to fractures of the extremities. Extremities can be fractured with like hands and legs can be fractured by direct force or indirect force. Direct force may be won by penetrating force like firearm injuries. Focal force, that is the injury at the only one part, small part of the bone, occurs when small force is applied to a small area resulting in a transverse fracture. Usually if there is a only one part of only local focal area is has impacted, then there may be chances of transverse fracture occurs, that is along the transverse line. There may be crush fractures occurs when the large force is applied over the large area, like in a road traffic accident, complete bone may be crushed. In this overlying soft tissue is extensively injured and often fracture is communicated. So in crush fractures, bone is fragmented as well as the overlying skin is also fractured. In focal fracture, compared to that, the overlying skin is intact. The fracture of the extremities in indirect force, this can be caused because of traction fractures. So in this, the bone is pulled apart by traction. So this is seen many times in case of common example is by injury of the upper part of the patella. So upper part of the patella is usually broken off because of contraction of from thigh muscles like quadricep muscles. Then rotational fracture, the bone is twisted and spiral fracture occurs. So in this, the fracture is along the line has a spiral fracture occurs. Then vertical compression fracture produces an oblique fracture. So here when the bone is compressed from up and down, there is chances that there is an oblique fracture may occurs of the body of the long bones with hard shaft driven into the calcaneus end. So both these two ends of the fracture, because of the compression, they break in the oblique force and they get impacted within each other. Next is in the angulation and compression fracture, the fracture line is curved. Then in angulation, rotational and compression fractures are usually oblique. So these are different images, that is closed fracture where skin is intact, open fracture when the fragment of the bone pierces the skin, Transverse fracture, which may occur when the force is along the upper part, along the axis. Then there is spiral fracture. Then there is comminuted fracture where there are multiple bone fragments are present. Impacted fracture where both the ends get impacted with each other. Green stick fracture, which is seen in young children. Then oblique fractures. Autopsy findings. Autopsy of a fracture may be suspected when there is extensive swelling and discoloration of the skin. So if there is underlying contusion in case of postmortem, they should be suspected of any underlying fractures. Or when there is abnormal mobility or cryptus when found during a examination of rigor mortis. When mobility is tested, if there is abnormal mobility is present, that the bone is moving in abnormal direction, then the fracture has to be suspected. Tissue surrounding suspected fractures should be dissected to determine the injuries to the soft part. This also will be helpful to know whether the fracture is antemortem or postmortem. In adults, blood loss in compound fracture of femur may be 1 to 3 liters. Compound fracture is when the fracture part of the bone fractures also damages the skin. So if there is a fracture of the femur is present, compound fracture of femur is present, there may be 1 to 3 liters of blood loss may be present. If there is a closed fracture of femur, if the femur is fractured closed, means the skin is intact, there may be chances of 1 to 2 liters may be lost. Closed fracture of lower leg may have 1.5 to 1 liter of hemorrhage. Then fracture dislocation of ankle have 0.5 to 1 liter. Differentiation between antemortem and postmortem fractures. Fracture caused by some hours before death show signs of effusion of blood, laceration of muscles, edema, which are not seen in the fracture produced by after death. So usually antemortem for fractures has huge effusion of blood, plus there may be some laceration of muscles and edema. Antemortem fractures few hours prior to death will show edema and active cellular infiltration. So within few hours of death also sometimes there may be presence of cellular infiltration into adjacent tissues between the fractured edges of the bone. Antemortem fracture of the long bones may result in fat emboli traveling to the distant part of the body, producing characteristic lesions like punctuate hemorrhages, skin, eyelids, and conjunctiva. So antemortem, if there is fat embolism is suspected, that is sure sign that there is a chance of antemortem fracture. Now coming to healing of fracture. So immediately after fracture, there is hemorrhage occurs at time of injury and hematoma is formed. So first, after the fracture is present, there is presence of huge hematoma. Then after partial organization of blood clot, fracture gap may be filled with condensed, highly eosinophilic fibrins. So once hemorrhage is present, there is clot is formed, then the eosinophils starts forming. Then within 1 to 2 days, there will be migration of polymorph cells, that is neutrophil eosinophils. Then necrotic tissue and macrophages starts accumulating in the fracture site. Afterwards, near the fracture site, new vessels start developing and numerous fibroblasts start seen within 7 days. So fibroblast starts accumulating near the fracture site. Small area of bone are laid down around the blood vessels in an irregular interval manner within the week. So along the blood vessels, as the blood vessels accumulate along the fracture site, new bone starts forming. The woven bone is formed equally by periosteal, endosteal, and marrow cells. Along the blood vessels, bone starts forming. Then fibroblasts lay down reticulum and then collagen, which is usually taken by 10 days. Then osteogenic granulation tissue is formed, accompanied by hyperemia, edema in 4 days. Cellular elements give rise to osteoblast, chondroblast, which produces a matrix of collagen and polysaccharide impregnated with calcium, called as callus in 2 weeks. So within 2 weeks, the fractured bone, there is callus formation is present. So that is with deposition of calcium, collagen, and polysaccharides impregnated with calcium. This callus is present within by 2 weeks. Histologically, some necrosis of the bone may be seen within 2 days. Much of the damaged marrow with fracture is invaded by vascular fibrocellular tissues by 15 to 20 days. At X-ray examination, callus is not readily visible for 3 weeks. So after 3 weeks, when calcium deposition increases, the fracture callus may be seen. A periosteal callus gap is usually obliterated by 30 days. So within 30 days, the gap is obliterated. Callus is formed into hard bone about 2 months, although the bone still undergoes reconstructive modeling. So After the callus, which is the overgrowth of the calcium, it is remodeled and it is removed by cells, osteoclastic cells. Then it starts remodeling occurs. After healing is complete, an approximate estimation of the age can be given from extent of remodeling, smoothness of the edges, and form of tubercle passing through the line of fracture. So based on the how much remodeling has occurred, approximate age can be formed. This is also helpful to know whether in case of dead bodies, if there is a fractures is seen, suspected, then if there is a chances that there is a remodeling is present, that indicates that old injuries are present. If a fracture is inadequately immobilized, repetitive movements of the limb causing tear of granite tissue may occur with recurring hyperemia. Then there is continued resorption of bone and delayed venereum will occur. Now coming to injuries to the joints. So injuries may be caused by blows or falls or by dislocation. So any type of blow in the joint may cause the injuries. Any injury to synovial membrane, interarticular cartilage, the ligaments, capsule of the joint may be accompanied by transudation of serous fluid into joint cavity. So any direct force to the joints may cause transudation of serous fluid. So it may be the injury to the synovial membrane, interarticular cartilage, or ligaments. Laceration of synovial membrane or joint cartilages or fracture dislocation can cause hemorrhage into joint cavity. So any injury which may cause lacerations may cause huge hemorrhage into the cavity, joint cavity, which may restrict the movement. Serious effusions are observed, but blood is organized with interarticular adhesions as the joint starts healing. Dislocation may occur due to direct violence like falls, blows, or muscular actions, or spontaneously when joints are diseased. So except from the direct injury to the joints, some indirect injuries may lead to dislocation of the joints. They are not dangerous unless they occur between the vertebrae or a compound. So unless the dislocated bone pierces the skin, they are not so dangerous. But only if the dislocation in the spine is the vertebra is present, it becomes dangerous. Punctured or incised wound of the joints are likely to become infected and the chances of septicemia may occur. Coming to injuries to the pelvic regions, in severe trauma, pelvis undergoes various fractures as well as dislocations. When there is application of great pressure to the front of the abdomen, so usually the pelvis region, if the front of the abdomen injury is present, then the pubic area such as run over by the wheel, the pelvis is splayed open. So if there is anterior posterior force is present, then the pelvis is opened. Symphysis fluid separates and one or both sacroiliac joints are also dislocated. When the impact occurs from side to side, then superior and inferior pubic ramus are fractured with dislocation of sacroiliac joint and the site of impact. Then in circumstance of fall from height on the feet due to transmission of force up the legs, both the sacroiliac joints may dislocate and even one or both femoral head may driven into the acetabulum. Due to kicks or heavy fall on the base of the spine, fracture of sacrum or coccyx may also result. Complications of fractures, usually there is shock because of loss of hemorrhage, there are pain, then there is crush syndrome where multiple bones as well as skin muscles are damaged, leading to further damage to the skin, further damage because of dislocation of emboli or muscle damage. Then there is hemorrhage, fat embolism because of marrow, then infection, then venous thrombosis and pulmonary embolisms are also different complications of fractures because of which the person may also die. Medical importance, all types of fractures and dislocations comes under grievous hurt which is punishable by 10 years. Fractures could be antemortem or postmortem in origins. Usually antemortem fractures shows blood clot which is not seen in postmortem fractures. These are my references. Thank you.